Good evening and welcome to First Aid Chats by Dr. G. I'm Dr. Adana Grandison, a physician in Barbados and your hostess for this evening. First Aid Chats by Dr. G is a live podcast that provides listeners with a unique opportunity to not only hear complicated medical conditions explained, but also clarify any misunderstandings you may have about that condition. After all, a medically aware and educated patient is an empowered patient. And this evening, our episode is entitled Bush Teas, Better or Busted? The Effects on Hypertension and Diabetes. And our guest is none other than Dr. Elliot Duglin. He's with us this evening for his third session, and we will be covering from condiments like salt, as well as talking about a Caribbean common item within the household, the infamous or famous, depending upon who it is, bush teas. Good evening and welcome, Dr. Duglin. I'm just going to ask Dr. Duglin now to just call in so that we can have him, and then we'll start. Hello, good evening, Dr. Duglin.
Hello, good evening. You can hear me?
Yes, please.
Yes, well, thank you, and it's good to be here, and welcome to all. Looking forward to this subject on bush teas and the evidence or lack of evidence for some of them and so on. Thank you.
Great, excellent. So, Dr. Duglin, what really is a bush tea?
Well, okay, thanks for that question. Let me start by saying that true teas are brewed from the leaves of the Camellia sinensis plant, green tea, black tea, oolong tea. So that decaffeinated green tea is a good beverage, and decaffeinated green tea extract with epigallogalic acid, powerful antioxidant. But on the other hand, now, herbal teas are made from dried fruits, flowers, spices, herbs, or the leaves of fruit trees, and these are called the herbal teas, in contrast to the true, original, traditional Camellia sinensis teas. So a herbal tea, herbal teas are made from dried fruits, flowers, spices, herbs, or the leaves of fruit trees. In addition to being refreshing and delicious, some of them have evidence-backed science that they promote health and may be useful to help in certain conditions. That's an initial definition. I can start by looking at some of the ones that are well established before I come to some that are peculiar for the Caribbean, which recently have been the subject of research.
Absolutely.
But let's look at chamomile, for example. Well known, chamomile is a calming tea, a sleep aid, but it has been shown by research to be anti-inflammatory and soothing to the stomach. So good for people with gastritis, acid reflux. Even if they're on Helicobacter eradication treatment, chamomile herbal tea is soothing and so on. But studies also indicate that chamomile contains a substance called apigenin, which they're now looking at as an anti-angiogenesis agent in cancer. That is, it helps to block cancer cells, causing new blood vessels to be formed to supply the cancer with blood, chamomile. But it can also help to improve glucose levels, insulin resistance, and blood fat levels. So these herbal teas are sugar-free and are much healthier than using the sweetened drinks. And chamomile is an established one that, while they're continuing research, certainly preliminary evidence suggests it is a valuable tea for the stomach and as a calming tea, that is chamomile. Moving on to peppermint, which is also well established, known to be good for the GI tract because peppermint oil helps to relax the smooth muscle of the gastrointestinal tract. And some gastroenterologists recommend, for example, peppermint oil for irritable bowel syndrome. Peppermint tea, because of the content of the antioxidant, anti-inflammatory in it, helps also to, strange enough, boost the immune system. Helps to fight off, helps to keep the immune system up against viruses. It is a refreshing tea, and it is quite healthy. Moving on quickly, ginger tea, which is traditional in most parts of the world, very healthy. Gingerol is the active ingredient, anti-inflammatory, antioxidant. Studies have shown that ginger tea is also anti-nausea and helps to be anti-vertiginous. It is good for the stomach, and its anti-inflammatory impact. If a person is going on long trips, it helps to allay travel sickness along with taking a dimenhydrinate or whatever the person may be taking for people who are prone to travel sickness. So ginger is another refreshing tea, good for the stomach and anti-inflammatory, well known. Hibiscus flower, antiviral, anti-inflammatory, antioxidant. The thing with hibiscus flower tea, you have to avoid it with certain diuretics because it can enhance the diuresis. It also can, hibiscus flower tea can interact with and shorten the action of aspirin. So it shouldn't be taken at the same time a low dose aspirin is being taken. And if a person really needs the impact of a low dose aspirin, they may have to avoid hibiscus flower tea, which otherwise is a pretty good tea.
All right.
Then comes echinacea, which is well known. The thing about echinacea is that despite the promotion of it as an immune booster, studies have been mixed, conflicting. And some studies have shown that it does help in the immune fight against viruses and so on. Others have shown otherwise. Some people get allergic reactions. Some people get migraines from it.
Right. Absolutely.
But yeah. Then there's the rhubarb tea from the Southern African area. The red leaves of the rhubarb plant, no caffeine, anti-inflammatory, helps to lower the bad cholesterol and increase the good cholesterol. We see it now in our shelves here in the Caribbean. Rhubarb tea, a refreshing tea again, and caffeine-free.
And commonly used within the Asian community as well.
Yes. People who want to get away from caffeine and don't like green tea use that. It's quite refreshing. Then there is sage tea, and preliminary studies have indicated that sage is definitely beneficial for improving cognitive function. So it is good for the senior population. More studies are being done, but it helps in cognitive function. It also helps to lower blood lipids. Sage tea, very good for the brain. Animal studies have shown that it also reduces the risk of colon cancer, sage tea, but we will need some human studies to support that. Sage, a safe and good tea. Then there is lemon balm tea, an adaptogen, helps to relax, anti-inflammatory, helps as a sleep aid, and is very well tolerated and well popularly used across the world. Then I'm going to look at rosehip tea, made from the fruit of the rose plant, and has been shown to be anti-inflammatory in the arthritides, rheumatoid, and osteo, and good for the skin health. Another refreshing, safe beverage. And with these herbal teas, you don't have to use any sugar. And this one hasn't been shown to have any interactions thus far, rosehip tea. It is also a good source of vitamin C. Then we come to passion flower tea, made from the leaves of the passion flower plant, the stems and the flowers as well. And this is again noted for helping to relieve anxiety and as a sleep aid. Hasn't been shown to have too many other benefits. It is said to contain some antioxidants, but they haven't been studied in detail. It is recognized as a safe, calming tea. The thing about these herbal teas is that they can be used sugar-free, they're refreshing, and they're a much better alternative than sweetened drinks. Now I'm going to look at the ones that we know in Barbados and the Caribbean, and that we have some research on in recent times. The blue vervain plant.
Absolutely.
Popular in the Caribbean, Jamaica especially, Barbados. The blue vervain plant leaves is Verbena officinalis, over 250 species. Known to be anti-anxiety, helps with sleep, also antibacterial. A 2016 study showed that the blue vervain extract could eradicate some 24 different strains of disease-causing bacteria. And studies in China showed that it could also help prevent colon cancer cells from metastasizing. Interesting. So they're doing some more research on it out there. Interesting that the history of the blue vervain dates back to the 18th century. It was called a general herbal cure, and it was then pushed for kidney stones, but the research has not confirmed anything at all about being good for kidney stones. No evidence to support that. But yeah, sorry, go ahead.
And certainly this same blue vervain, this was used historically for things like cuts and wounds,
yes,
those sort of things, yeah?
Oh yes, used as a general overall cure in the medieval times.
Yeah.
It is being said now that one should be careful with it if there is chronic kidney injury. Shouldn't be used without supervision in that area, but otherwise, and it shouldn't be overdone. It shouldn't be, because it can cause lightheadedness in some people. So they usually recommend about 2 to 3 leaves steeped in a teacup for about 15 minutes every other day as a refreshing beverage. Don't overdo it. Don't make it too strong. But quite popular here in the Caribbean.
How does blue vervain and hypertensive medication, is that a challenge? Because I know for a lot of the bush teas, one of the significant questions that we always have is, what impact will this have on the NCDs?
Yes, I'm coming on to some of the others that are more specific there, but blue vervain doesn't seem to impact too much on blood pressure lowering medications. What it can cause allergies, it can cause a skin rash, and it must be avoided in kidney disease. Of course, any of them should be used with caution when a person is on medication for any chronic disease, and the doctor should be informed. Doctor should ask, because patients may be reluctant or nervous about mentioning these things because they think there's a general prejudice against them among their physicians, and therefore the physician should encourage non-judgmentally the patient to talk about any bush tea they're on so that advice can be given and interactions can be checked and talked about.
Right.
But blue vervain certainly should be avoided in kidney disease. Persons with eczemas will have to be careful. It is good for calming, and it has been shown to have some anti-inflammatory effect. Here in Barbados, people use it as a cure-all, but anything that cures all usually cures not much. So it isn't to be looked at in that way, but otherwise it is pretty popular and pretty safe. Move on to Cerasee, which is a big thing in Jamaica and all through the Caribbean. The leaves of the bitter melon plant. These are the leaves that are used. Antioxidant, contains gallic acid and catechins, helps like the bitter melon itself to lower blood sugar and blood pressure, and anti-inflammatory. A number of cautions here. Has to be used carefully, therefore, with blood glucose controlling medication, anti-diabetic medications, and antihypertensive medications, because it may cause a drop in sugar or blood pressure, depending on how much you use. And then in Jamaica, it has been shown, from the time I was a medical student, I remember hearing this piece of research, that in some people, not all, long-term use of Cerasee can result in liver injury, centrilobular liver injury, leading to a cirrhosis. Uncommon, but has been documented in some people who are sensitive and use it perhaps for decades. But in the short term, it has immune boosting. People use it in the short term, traditionally for colds and flu and so on. But the research shows that it does have an impact on helping to regulate blood sugar, blood glucose, immune boosting, anti-inflammatory. And as you know, some research is now showing that bitter melon extract, they're looking at it in terms of cancer fighting properties. So the caution, the caution here would be to be careful with blood pressure drugs and anti-diabetic drugs, and prolonged use should not be encouraged. The experts say use it and stop. Use it again and stop. Not consistent prolonged use, as some Jamaicans used to do in the 60s and 70s, and though uncommon, a few of them ended up with this liver injury. Cerasee.
And certainly something that we have I've heard in growing up, where you would use Cerasee bush for tea. If you have a bad tea a bad cold, that you couldn't shake, you would use the Cerasee bush. But I'm happy that you told persons it is not really something that you should be using long term.
That's right. Not just consistently all the time. Use it intermittently and stop. Intermittently and stop. The fruit itself, which is a big thing in Southern Asian countries, has similar properties, but when you saute it or steam it and so on, there seems to be less of this. There's been no evidence for that impact on the liver from the steamed fruit, but the leaf tea, one should be careful in just using it all the time.
Right. Absolutely.
That's Cerasee. I'm going to come to a popular one in the old time days, but has faded out now. But Professor Dr. Henry Lowe in Jamaica has done a lot of work on this one. The famous gully root. Gully root tea. It is called Guinea hen weed in Jamaica and anamu in the Spanish countries. The thing about gully root is that Professor Lowe has shown it contains powerful substances. One of the most powerful one is it contains triterpenes, but one of the most powerful active ingredients is dibenzyl trisulfide. And Dr. Lowe has shown that dibenzyl trisulfide is antiviral and anti-platelet. That is a blood, what we would call a blood thinner. The important thing he looked at, along with Professor Bryant at Maryland University in the USA, is an anti-cancer action. So they had this article about a cancer cure some years ago, which was misleading, but Dr. Henry and Professor Bryant Dr. Henry at UWI, Professor Bryant at Maryland University saw that the gully root extract and the have it in extract form can help with whatever other treatment a person may be using in certain cancers like prostate, breast, stomach.
Right.
So I once met an old man who was 97 and he had a perfect prostate and he was in good shape. And he told me, Dr. Duglin, the young boys using all the fast food. I was brought up on good old gully root tea.
Right.
And he says at 97 my prostate is good. And I won't tell you what else he said. He said I'm batting strong. I laughed.
Right.
So gully root, a traditional tea. A lot of youngsters don't know anything about it now because you have to know it and find it has a strong sulfur smell. The dibenzyl trisulfide, anti-inflammatory, antiviral, good for fighting off flus and so on, and a cancer protective effect. Good old gully root tea, but you should avoid excessive use because as a blood thinner, it can be it shouldn't be used with aspirin and so on.
Right.
And an important thing is that pregnant women should avoid it.
Absolutely.
It can cause the uterus to contract and cause miscarriage or abortion. So pregnant women should avoid it. Should not be used excessively. Should not be used with blood thinners. But other than that, use intermittently. It has anti-inflammatory, antioxidant, and cancer-fighting properties. And a lot of old folk in the old time days came along on it when breast cancer and prostate cancer were much less of a problem back then because of better food and some of these herbal things that we are now looking at in research. So good old gully root tea is still there. More research is being done by Dr. Lowe in Jamaica and Professor Bryant in Maryland, but the capsules extract, they sell through Amazon for people who want to use it in prostate cancer and other issues in terms of an adjunct, not to cure with other medication. Then we come to neem leaf, which is catching on here. Neem is called the pharmacopoeia tree. It is a powerhouse of pharmacology in the leaves. It is antibacterial. It is anti-parasitic. You can use neem leaves and boil them and put it as a spray on your plants to keep away fungi and other insects from attacking your plants. So powerful it is. But it has been shown it is good for parasites, bacteria, worm infections, even in the human. But it has been shown to definitely help to lower blood pressure and blood sugar. And therefore, it would have to be used carefully with medication, with doctor's supervision. The neem leaf, it should never be used in large amounts because it can cause a drop in blood pressure and dizziness. 3 leaves steeped in a teacup for 15 minutes usually is the recommended portion. It is immune boosting, cancer fighting. It helps with disease of the gums as well. You can sort of blend it up and do a rinse. It is very good for skin health. Here in Barbados, a lady who has pioneered it has prepared a cream, a skin balm from it, and I've recommended it in some cases. I know one or two of the dermatologists look at it as well, and it is very soothing, along with even if you're using a topical steroid in certain kinds of dermatoses. So it's very good for the skin. The neem, antibacterial, antiparasitic, very bitter, so people don't like it, but it's immune boosting. Side effects, you can get headaches. It should be known that it interacts with lithium, so people on any lithium therapeutic dose for bipolar disorders and so on should avoid it. And in the presence of diuretics, it can enhance excessive sodium loss. So diuretics, you would have to be careful. Lithium is a no-no. It does lower the blood pressure. In combination, people use it in combination sometimes with Mabi bark and coconut water. And studies in Jamaica have shown that Mabi bark and coconut water can help to lower blood pressure. It can drop the blood sugar too low with diabetes medication. So if a person is using the anti-diabetic drugs and also using the neem leaf tea, the doctor should be aware as to monitor things and see how to adjust. But it is a leaf that is subject to ongoing research, and it definitely has been shown to have blood pressure lowering, glucose lowering, and cancer fighting properties, as well as antimicrobial properties, good for the skin, good for the gum. Should be avoided in patients on lithium. Should be careful with patients on diuretics. And if you are using it, your doctor should know if you are diabetic on blood glucose lowering medications. It is another leaf that, like the gully root, should be avoided in pregnancy. It can cause abortion in early pregnancy. So neem leaf, avoid in pregnancy. Gully root, avoid in pregnancy. So that's the neem leaf. Fairly popular in Barbados now. Some people just go and use it, but I like to give advice on it, especially in terms of medication interactions. It is good, but you have to know what you're doing. Then I move. Yeah, go ahead.
Dr. Douglin, you just spoke about the neem leaf, which we know is usually associated with blood sugar control. What
Yes.
about the common, what I grew up hearing about dog dumpling, or what we know as noni?
Yeah, I'm coming to that soon from now.
Okay.
Yes. Well, moving on from the neem leaf, there's the guava leaf, which is catching on. A lot of research has been done on guava fruit and leaf. The guava leaf tea, the benefits: antibacterial, antifungal, helps with treating diarrhea, and helps with blood glucose control. Guava leaf tea.
Right.
It has quite a bit of quercetin and lycopene and other catechins, and it exerts immune boosting and cancer fighting properties. In some people, however, it can aggravate eczema, and in some people, it can cause dizziness and lightheadedness, because in some sensitive people, the blood pressure may drop, but it is good for glucose control. It is a good tea. You don't have to use it strong. It is a refreshing tea, but some people can use it at higher strengths under supervision to help in certain conditions. Guava leaf tea, a lot of research being done on guava leaf tea, and guava, especially the red guava, which is richer in lycopene, is quite a protective fruit. Guava leaf tea. Another good tea, but again, one has to be careful with the glucose lowering properties if one is on anti-diabetic medication. Then there's another famous one from the old time days, the avocado or pear leaf tea. All the old people talk about pear leaf tea from the old time days.
A cooling
It has been
tea.
shown. Yeah, yes, a cooling tea, which means anti-anxiety, anti-stress. Has been shown to improve blood flow to the brain, helps in reducing stress. It is an adaptogen, as it were, and also has been shown to help reduce the frequency of asthma attacks in mild asthma. Anti-asthma, anti-anxiety, has quite a lot of powerful antioxidants, and it does cause a drop in blood pressure and blood sugar. So if a person is using it and the person is on medication for blood pressure or diabetes, care would have to be exercise and counseling given. And it has been shown too in some preliminary studies in animals and preliminary studies in humans to help prevent kidney stone formation. So anti-inflammatory, helps prevent constipation as well. So the old time people had this as a favorite tea, and they did very well with it. Improved blood flow, helped to reduce stress, help to minimize asthmatic attacks, improves digestion, helps to prevent constipation, anti-inflammatory, helps to prevent kidney stones, and used to be used a lot in the old time days as a cooling tea. They never used it too strong. And nowadays, we know it can drop the blood pressure and the blood sugar, so care would have to be exercised there. But another good tea, much healthier than the sweetened drinks that the young people use nowadays, and that only shows how we've gone away from certain things that now research is showing may have certain benefits. And the old people came along the pear leaf tea as a sort of staple tea. They couldn't go and afford and buy the exotic teas, and they had no supermarkets in those days anyhow. And good old pear leaf tea was a staple well all along the years before 1960. All right, I'm coming now to coming to noni. But before I get to noni, papaw leaf or papaya leaf tea. Now this is
is this what we would call a green papaw leaf tea?
Yeah, the green papaw leaf tea or the green leaf. You can use the leaf green or yellow, but we're talking about the green leaf because this is an important piece. Now it is anti-inflammatory and has anti-cancer properties and can help in blood sugar control. But now this is 3 human studies with several hundred people have shown that the green papaw leaf juice or tea can increase the platelet count in dengue hemorrhagic fever and help to prevent dengue hemorrhagic shock. 3 studies. And so I've known people to have used it. 2 things out in India, they've shown in India that vitamin D helps to prevent dengue from going on to dengue hemorrhagic complication or dengue shock fever. And that green papaya leaf juice or tea does the same thing. So people with dengue fever, it is recommended that they make sure, just like in COVID, that their vitamin D levels are up. It helps to prevent the progression on to complications of the dengue hemorrhagic or dengue shock syndrome. That is vitamin D, and now papaya leaf can be used. And I've known people who have been pretty ill with the dengue illness, and they've used the papaw leaf juice, just for a couple of days, and stabilized and pulled through. And 3 human studies have been done to show that it does raise the platelet count. If the platelet count is dropping as dengue tends towards the complication of dengue hemorrhagic fever, it can raise the platelet count. So this is scientific evidence-based 3 studies showing its value. So there we have it. Yes, go ahead, Dr. Grandison.
Any challenges in terms of from a blood pressure standpoint, though? Because I always knew the green papaw leaf to be associated with bringing down the blood pressure.
Yes, but more so the green papaw fruit. The older folk used to use the green papaw and cook it, or sometimes blend it and juice it for the blood pressure. The green leaf can also help lower the blood pressure, but in people with viral illnesses, it has been shown to help, and certainly in dengue, it raises the platelets. So what the person would need, of course, is to keep their fluid intake right up. And use the papaya leaf juice under supervision if there is any tendency towards the hemorrhagic problem, because it definitely raises the platelet count, which would have been dropping as this complication developed. So more studies are being done, but that is interesting, especially as we are faced now with a dengue threat in the middle of a COVID threat.
Absolutely, and I'm glad that you brought up that distinction: the papaw fruit.
Yes.
The papaw leaf. Right. So thanks a lot.
All right. The next one let me move on now to I'm going to leave the noni for the last, but I'm moving out to breadfruit leaf tea, another one that is quite popular. And all of these teas are even more popular in Jamaica, Guyana, than Barbados, but breadfruit leaf tea is quite popular across the Caribbean. Studies have shown that the breadfruit leaf contains gallic acid, quercetin, and camphorol, which are anti-inflammatory and help with blood pressure, especially, and to some extent, glucose. So it is pushed by herbalists and naturopaths as a blood pressure lowering leaf tea. But there's a drawback. It seems to lower blood pressure by an action, the camphorol, like beta blockers. In other words, it tends to reduce the cardiac output as part of its effect in reducing blood pressure. It may cause the blood pressure to go too low if the person is already on anti-blood pressure treatment, and it should not be used in heart failure.
Absolutely. And that is certainly because if you're reducing your cardiac output, the heart is not getting as good a contraction as possible.
That's right.
So certainly if you have heart failure where your heart is not working as well as it should, you're not getting as good a contraction, this is something you want to stay away from.
That's right. So it is a good tea used judiciously in a person who has a strong heart, and it can aid in bringing the blood pressure down, but shouldn't be used excessively, should be avoided if there's heart failure. And if the person is on other blood pressure medications, they would need counseling, and their physician should know to give them some guidance here. But breadfruit leaf tea, studies are going on because the gallic acid in it has also been shown to exert cancer fighting properties. Quite a lot being done on it too, because I think Dr. Lowe in Jamaica is looking at it as well. He does a lot of phytopharmacology.
Right.
Just as we know our Damien Cole here, Dr. Damien Cole, his PhD is in phytopharmacology. He likes that area as well. But Dr. Henry Lowe does a lot of this work, and he's looking at the breadfruit leaf and these leaves that are quite popular in Jamaica. So the breadfruit leaf tea may drop the blood pressure too low if the patient is on medication for blood pressure, should be avoided in heart failure, and can also help with glucose control. And you don't have to use the whole leaf, because breadfruit leaf is a big leaf. A portion of the leaf, steeped again, and not too strong, can be a refreshing drink. But anybody on blood pressure medication, anybody with a heart problem, shouldn't use it without first discussing it with their physician. If you're healthy, it can be a refreshing tea. But with these issues, you must know and know how to have advice. Well, the noni is a powerful fruit and leaf. The extract is made from the fermented fruit as well as the leaf. Some extracts contain the leaf extract and fermented fruit extract. The thing about noni is that it has been shown to have a number of pharmacological and therapeutic properties, some with just animal studies, some with human studies. For example, it has cancer fighting properties for sure, especially in the areas of prostate and breast. It can lower blood pressure and blood sugar, so it should be used with care if a person is on medication. It has been shown to be quite good for certain skin conditions, noni, and it is it helps with the bacterial flora in the gut, and it exerts antifungal, antibacterial actions as well. Now, it has a pungent taste if you're drinking the juice. The leaf, if you're making a noni leaf tea, is less pungent than the fruit and should be used not in excess, but it is refreshing. Some people put it in a smoothie, and it gives a pungent little kick to it. Not used in excess is usually no problem, but anybody on blood pressure medication, anybody on diuretics would have to be careful, but it does exert anti-inflammatory and anti-proliferative impact in the body as the leaf tea, as well as the noni fruit extract. A lot of research being done on it, and it is considered a good, healthy supplement within the constraints of knowing how to use it, so long as there are no other issues. All right, so those are the common teas. Of course, I didn't mention there is oregano. Oregano leaf tea can be used. Oregano is a spice, and cinnamon. So cinnamon helps to lower the blood sugar. There is no doubt. And a cinnamon tea or a cinnamon spice or a cinnamon extract will lower the blood pressure. So definitely you would have to be careful if you're lower the blood sugar, if you are on anti-diabetic medication with cinnamon. So cinnamon is a glucose lowering spice, whether in tea form, used like that in drinks or used in baking. And the important thing is that research has shown two beautiful things about cinnamon. It is brain friendly, helps to improve cognitive function, and exerts anti-cancer and cancer fighting properties, especially for prostate and also breast, and to a lesser extent colon. So cancer fighting properties, brain health properties, glucose lowering properties, cinnamon, considered by many a super spice, should be used carefully because research shows that excessive use can hurt the liver. So never be excessive with it. But definitely good for brain, cancer fighting, and good for glucose control. And if a person is taking an extra or using the tea, cinnamon tea, with anti-diabetic medication, they have to be careful and be doing the monitor. Of course, here in Barbados, our problems are usually bad control. So,
Right.
but if you're in a tight control already, to
Right.
use a cinnamon extra or cinnamon tea may drop the sugar a bit too low. But an important herb, just remember, no excess because of the liver, but otherwise good for brain, cancer fighting, and glucose controlling. Cinnamon extract, cinnamon itself in cooking, baking, and so on, and the cinnamon tea. Then there is clove.
Mm-hmm.
Sorry, go ahead.
No, I'm gonna let you finish that because I wanted to ask about some other things that commonly we hear being used here that are not teas, but certainly not certainly, we've heard the debate about if they really have an effect on some of these NCDs. But I'll let you finish off with clove and then I'll go ahead and ask you. Go ahead.
Yeah, okay. Clove is anti-inflammatory and has been shown to be very soothing for the stomach, helps in stomach ulcers, superficial stomach ulcers, gastritis. So if somebody has a gastritis, even if it's Helicobacter pylori induced and they're getting Helicobacter pylori eradication treatment and so on, and they want to know what to use while they're on treatment, clove tea and cinnamon tea and garlic tea are soothing for the stomach. The garlic tea must be dilute. Of course, garlic tea is another one that is immune boosting and cancer fighting and can both drop the blood pressure and the blood sugar. So garlic, and it has blood thinning as the common person will use the term, antiplatelet function as well. So these should be used with care on any medication, and a healthcare professional doctor should inquire of the patient, are you on any of these? I'm not asking you to condemn them, and I'm asking you to give you guidance and so on, because they have their place, they're useful. A lot of people use them. They may not want to volunteer the information to the doctor, but it is good for the physician to know, to give guidance, because clove is soothing for the stomach. But again, clove in excess can be, in clove oil, for example, in excess can be injurious to the liver. So you don't want to be excessive. Want to be excessive there. Okay.
So Dr. Douglas, one of the questions, especially from a toxicology standpoint, is we hear about all of the benefits of these teas. Some of them have been proven scientifically, but bush tea making is really an art. Just like other herbal medications that have been used in Asia, for instance. And certainly there's always the question about exactly how much you should use. And even certainly between plants, you may have varieties in terms of strains. And so what may work for me, I may use 3 leaves on one plant, certainly may not work for someone else, may cause very deleterious effects, simply because there's also the human variation aspect along with the plant variation. So can you talk about that for me?
Yes, but that is why some experts believe then that this is where the commercial aspect comes in. You can go and buy the teas that are bagged, where they have a certain amount dried and powdered and put in a tea bag. So you know how much that is, and they have estimated that would be a standard amount you can use, 1 tea bag as a general average usage that would not be problematic, and you should only go up to 2 or more tea bags under supervision. Right. Because when you do it that way, when you dry and powder the leaf in the commercial tea preparations in health food manufacturers and so on, they now standardize
Mhm.
the powdered leaf so you know exactly how much you're getting. If you're just picking a leaf, it is going to vary from herb to herb and individual to individual. That our grandparents used to do it. They didn't get much of a problem, but it was not standardized, and you
Right.
weren't sure what you were doing in terms of if you wanted a better impact or you wanted to avoid negative impact.
Mhm.
But so the health food manufacturers, when they dry and powder and package into a particular little package, and this will be a little bag that you're going to steep. They then recommend, well, 1 or 2 or go up onto supervision in certain conditions. Otherwise, if you want to be more exact, you have to move from the tea to the standardized extract of the particular thing to know what to be
Exactly what you're
absolutely sure of dosage.
Absolutely. And I thank you for clearing that up because, sometimes, yes, these things are quite beneficial. And I'm also happy that you spoke about discussing the bush teas with your physician, because it is certainly essential, especially if your physician is prescribing medication, increasing your dose of medication so that we can monitor or know exactly what we're dealing with. Now, I want to move on to some condiments and some other herbs that we may not necessarily use in the form of tea, but are quite common within the last few years. We keep hearing about them. I want to ask about 4 or 5 in particular. Um,
Okay.
Turmeric is one.
Mm-hmm.
Moringa is another.
Yes.
We've heard lots of talk about parsley water, right?
Mm-hmm.
And then I've recently seen persons using what we call, we usually see it on the side of the road. The name is actually evading me right now. It's used for diabetic control, rivertambrine.
Okay.
Good.
All right.
So let's start
Well,
with turmeric first.
yeah, well, turmeric has been the subject of thousands of studies, thousands of papers published. The curcuminoids and the curcumin, well studied, well established. There is no doubt now that the evidence, the scientific evidence is clear. Turmeric is a master anti-inflammatory, antioxidant, anti-proliferative molecule, very good for cognitive function, helps to reduce the risk of cognitive decline, anti-cancer or anti-cancer chemo prevention. Wonderful stuff, no doubt about it at all. The research is showing that the fresh turmeric, ground or blended into a smoothie, and sometimes with a little bit of black pepper with the piperine to enhance absorption, is the best for the brain. As a matter of fact, one study showed that the fresh turmeric had an impact on cognitive function, a positive impact on cognitive function, where the standardized extract didn't. So the experts believe that the fresh turmeric has its place.
Right.
Now, the standardized extracts, and then they have certain health manufacturing companies have engineered the product so that the bioavailability is enhanced.
Right.
Curcumin CM95 and others, that you get much better absorption. One of the best products is the one by Bosmed, Terinaturally, Curamed, ranked about number 1. But these, some experts believe you should use all 3, the fresh turmeric powder, and a good bioavailable capsule if you want to really impact cognitive improvement, cancer prevention, anti-inflammatory, is good for the joints. So this is a wonderful herb. If you use it as turmeric tea, there was some controversy over the impact of heat. One set of research suggested that cooking it or the heat would lower. And then I saw a brilliant Indian scientist, female in fact too, and she did some research and showed that so long as the cooking wasn't prolonged and temperatures didn't go above the boiling point of water, there was no significant reduction of the curcuminoid anti-inflammatory activity. So turmeric tea, some of the older folk used to use, and put in a dash of clove. Good for inflammation, good for so many things. The thing about turmeric is that in some people who are sensitive, they may be a bit too excitatory to the biliary tree and the gallbladder, and can cause a little bit of biliary colic if they already have gallbladder disease or a stone there and didn't know, which would be good in that it would show up and they would have to go and get an ultrasound to see what's happening.
What is really happening?
Gallbladder disease, one would have to be careful because it stimulates the gallbladder to contract.
Right.
Apart from that, there have been no known adversity. Of course, you have to be careful using it with aspirin or any other antiplatelet pharmacological agent, because it is such a powerful anti-inflammatory, antioxidant. It also boosts the immune system. And because it is anti-inflammatory, in viral infections like flu and so on in the respiratory tract, where it will enhance the immune system and at the same time reduce any inflammatory explosion like a cytokine storm and so on. So curcumin and the curcuminoids and turmeric, good to use the spice in the food, good to use it. They show that the northern Indians use much more of it than the southern Indians and have a considerably lower incidence and prevalence of Alzheimer's. So turmeric is good stuff. Just be careful with the biliary tree if you have problems there. And of course, on medications, you have to be careful with interactions because anything that is so powerful can interact with blood pressure or blood sugar or antiplatelet medication. The other one you mentioned was moringa. Now, moringa is considered a super food, a super herb. It is nutrition dense, and it again has anti-inflammatory, antioxidant, anti-cancer, cell healing, and brain cognitive enhancing functions. A lot of research being done on it. You have to be careful. Some people, when they use a lot of moringa, get lightheadedness or drop in blood pressure because it's so potent.
Absolutely.
And some people get dizzy. I know somebody who went on it and got dizzy. They used too much. They put a whole heaping amount of the moringa leaf powder in their smoothie, got dizzy, got vomiting, got diarrhea. So you can't overdo these things. They are powerful in phytonutrients. They have their benefits. You have to avoid excess. You have to always be consulting in terms of medication because all of these anti-inflammatory substances will have blood thinning effects, and therefore you have to consider other medications. You shouldn't be using them with anticoagulants like that without careful supervision. But moringa is considered a superfood, used judiciously and never in excess. It helps the overall body health because helps to enhance cell vitality, the immune system, anti-inflammatory, anti-proliferative, good food. People use it as a tea, moringa leaf tea, which is actually going to be safer in terms of potency than the using the powder, which is packed with all the molecules. So if you use a moringa leaf tea, much less likely to get problems from excessive use or too strong a use. But the powder which people use, you just have to be careful not to be excessive, but it is good stuff. No doubt about that. The other one you mentioned was
parsley water.
Oh, parsley.
Go ahead. A few years back, there was a big fad about using parsley water. I don't want to use my hypertensive medication. I'll just use parsley water. Any fat, or is this just fiction?
Well, it has been shown that parsley and the high water content vegetables like marrow, zucchini, and the other one there that the name just let me is have in Barbados with little spicules on the skin. Oh dear. You know what I mean?
With spicules on the skin?
Yeah, sometimes it's smooth, sometimes there's spicules on the skin. Christophine.
Christophine.
Yeah, Christophine, marrow, uh, zucchini. Those high water content vegetables can, if you steam them lightly and use them, use increased amount of greens and cut down your salt, can help lower the blood pressure naturally. Now, parsley has been definitely shown to help to lower blood pressure. Its potassium content is high, so only in high potassium and renal failure one would have to be careful, but definitely it helps to lower blood pressure. A person shouldn't just abandon their medication and go on it without telling their doctor and so on. That is not never advised, but it is very good and helps to control blood. It can help to control blood pressure. Parsley in the salads, parsley water, it has been shown to help drop the blood pressure. So one would have to be careful using it in abundance with blood pressure medication without telling the physician. But parsley as part of a salad, as part of cooking, would be quite healthy. The parsley water in excess, one would have to be careful with blood pressure medication because it does have a blood pressure lowering effect, studies have shown. And along with Christophine and zucchini, squash and marrow, there are the high water content vegetables, high potassium content. They tend to help lower the blood pressure as well. And those high potassium content vegetables have been shown to reduce the risk of cerebrovascular accident, to reduce the risk of stroke. And they're quite healthy. As I said, the only drawback is if a person has a high potassium and chronic renal failure, which is a different situation. That isn't the problem with the vegetable, that's the problem with the person's kidney. But yes, parsley is a very good vegetable. I saw a write-up on it not too long ago in which they were talking about the quercetin content, the camphorol content, which helps to relax the arterioles, relax the arteries, good blood pressure lowering properties, and good antioxidants as well. And the other one you mentioned,
the last one that I mentioned was the river tamarind. I know some farmers actually use it with animals just before they take them to market. And when I actually first heard about it, I was actually quite curious, and immediately did some research and came to find, quite interestingly, that river tamarind that we have growing quite a lot of it on the roadside going up the highway is that it actually has anti-diabetic effects.
Yes, it has been shown. Some studies have shown that it can have blood glucose regulating properties. There were some concerns about some other alkaloids and substances in it, so they were raising questions about overall safety. They were saying that, for example, the agriculturalists and the zoologists were saying that they don't see, for example, monkeys
eating it, correct?
Eating it as much as they would if it were absolutely safe by instinct. So they're saying that more studies are needed to check its safety, but it does exert glucose lowering properties. Whether we can use it for that without first checking the other molecules in it and their general safety would be the subject, but it isn't just recommended to go and use it unless that research comes to light.
Okay, I saw we had a call. I saw we actually had some comments as well, also in the message blog. Blue Vervain, we discussed earlier this evening, and I'm seeing a quick question here, about bay leaf. Any final words on bay leaf in our last few minutes? We have 3 more minutes.
Oh yes, bay leaf is another important common Caribbean tea, and bay leaf has been shown to help lower lipids, to help also stabilize blood pressure, and to be anti-anxiety, anti-stress, and to be one of the herbs that helps to lower interleukin-6, anti-inflammatory. Oregano helps to lower interleukin-6, bay leaf. So bay leaf is anti-inflammatory, anti-stress, helps to stabilize blood pressure, and is good for helping to stabilize LDL cholesterol and triglycerides. So bay leaf, a good safety, traditional again, and quite beneficial. Bay leaf tea.
So, Dr. Douglin, I am very, very happy that you took this time out, not just for this evening, but certainly for all 3 weeks, to actually really lend some clarity on things that we put into our body: nutrition, foods, herbs, and certainly how these things can affect the body and have an impact on non-communicable diseases. As you know, this year is considered the International Year of Fruits and Vegetables. And
Yes.
these 3 sessions have demonstrated quite clearly that eating correctly is quite important. It gives the correct building blocks, the fighting factors, everything that the body needs to help itself. And also, more importantly, that eating poorly on the converse end can have some very deleterious effects, using the wrong types of fats, removing carbs even completely out of the diet, as you did last week when you spoke about some of these extreme carb restricting diets and the impact, the negative impact that it can have on the body. So I just want to say thank you very, very much for coming for 3 weeks straight and having and being on the show, ready to share this information with the public. Thank you so much, Dr. Douglin.
You're welcome, and best wishes to you and your audience, and thank you very, very much.
And our guest this evening, I want to say thank you so much for listening. I do apologize for the change from yesterday, our usual schedule time, to today. That was done in an attempt to accommodate the national press conference. However, I know that there has been lots of fear, in addition to COVID, also about dengue. So next week, we will be discussing dengue with Dr. Ariane Harvey. And I just want to say once again, thank you so very much, Dr. Douglin. Thank you to our listeners. I want to encourage our listeners to follow us on both Podbean and Anchor, and join us next week again for our First Aid Chats by Dr. G, Closing the Gap. Thank you. Good evening.
Thank you.